lovely people, good day. How are you doing? Welcome back to my channel. This is NCLEX Target. Please, if you have not subscribed, kindly subscribe and hit on the notification button so that when we have a new video, you'll be able to have access to them. Today, we are going to talk about cardiovascular, which represents the heart. And you know, the heart also serves as well as the engine of the body. Remember, the heart is made up of 4 chambers. We have the right atrium, the right ventricles, the left atrium, and the what? The left ventricle before it moves through the aorta into circulation. Even though it is divided into 2, which is the right side and the left side. And the right side carries deoxygenated blood, and the left side carries what? Oxygenated blood. Now, we know when you take the heart is made up of 3 layers. Okay, and then we have under this we have the epicardium, we have the myocardium, and we have the endocardium. The epicardium is the outer layer of the heart, okay, and we have a pericardial sac under this, okay, and the pericardial sac also has 2 layers. We talk about what? The peritha and the viscera. The peritha is the toughest part of the pericardium, and then we said that it is the one that also protects the body against any injury. All right, and then the one that is thin and soft is the one that we call viscera. And within these 2, peritha and the viscera, we have pericardial cavity or pericardial cavity, and this cavity contains about 20 ml of fluid, and it is the one that cushions the heart anytime it pumps to protect it from what? Friction. Okay, to protect it from friction. So take note, we have a condition called cardiac tamponade. Anytime this amount of fluid is increased from 20 to what? To the higher amount, it means that there is going to be more tension in the heart, and then a condition called cardiac tamponade is going to occur. Okay, now when you talk about the myocardium, you said it is the thickest part of the heart, and then it is the one that also helps the heart to pump blood into circulation. That is why it is thick, and it serves as what? The heart muscle. And then we have the endocardium. The endocardium, we talk about it, we said it is the inner lining or the inner part of the heart. And take note, the valves are also part of the endocardium. Take note of that. And we have 2 atrioventricular valves, and under it we have the tricapside, and then we have the mitral valve. Okay, you have been hearing about mitral valve stenosis and the rest, all right? Now, the mitral valve is located at the left side, and when it comes to the tricapside, okay, on the right side. Now, let's look at the chambers of the heart. Now, when you talk about the 4 chambers, we have the right atrium, the right ventricles, and then we have the left atrium and the left ventricles. Okay, now, how does circulation occurs? What normally happens is that, you know, when a blood is collected through the vena cavae, when blood is collected through the vena cavae into the heart, what mostly happens is that, take note about this before, okay, then we have the vena cava, we have the superior vena cava, and we have the inferior vena cava, and it is the largest vein within the body, because all the blood, the oxygenated blood, after they are being used, okay, it's collected within these vena cavae before it is sent to the heart for another oxygenation to occur. That is very, very important. So it means that when the blood is collected, whether from the superior vena cava or the inferior vena cava, what mostly happens is that they are collected into the right atrium, and then the atrioventricular valve will open, and then the blood will now move into the right ventricles. After this, we have pulmonary artery, the only artery within the adult that contains deoxygenated blood. Now, this blood is collected through the pulmonary artery into the heart before oxygenation of the blood occurs. And after that, okay, the blood is also moved through the pulmonary vein, which is also the only the only vein that collects oxygenated blood, okay, in the body. So take note of that. So through the pulmonary vein, what happens is that the oxygenated blood is moved through into what? Into the left atrium before the mitral valve will open, and the blood is collected into the what? The left ventricles. And you know that when it comes to the left ventricles, it is bulky because there's the area that pumps blood through the aorta into circulation. Okay, that's why the muscles there is thicker. It is thicker because blood will now be pumped into circulation through the aorta. Now we know how the circulation has occurred. Okay, now let us look at something. Now when you are feeding a child, definitely you have to taste the food to see how the food looks like or how it tastes. It means that the heart that is sharing the blood through circulation, the heart also needs some of the blood. Because of that, it collect what? It also receives its blood from the coronary artery. It means that anytime there is a problem of the what? Of the coronary artery, it means ischemia to the heart will occur. That means that blood will not be collected into the heart, or the blood will not be what? Will not be moved to sponsor the heart, which is very, very critical. Okay, it means that we are going to have a condition called myocardial infarction or ischemic heart disease or coronary artery disease. Take note of that. All right, and then let's look at something here. The heart also produces its own electricity. We have the electrical conductivity of the heart, where we have the SA node. Now you ask me, how does pulse determine? How do you determine the pulse? The pulse is determined through this electrical activity. Now let's take it. We have the SA node, and the SA node is located at the junction of the superior vena cava and also the right atrium. Now what happens is that the SA node generates some current. You know, I told you it is electricity. So at the current, the amount that it produces is about what? It's from 60 to 100, and it is the one that determines a normal adult heart rate or pulse. Take notice of that. And you know that when it comes to the normal adult heart rate, it is between 60 to 100, and that is how the SA node generates the electricity. So it means that when it comes to the pulse rate, you have to deal with the SA node, because it is the one that is going to determine the heart rate. Thank you very much. And now let us continue with it. And you say that this determines the heart rate of the what? Of the adult. That means that the pulse. And then we have the atrioventricular node. And we say this one is located in the lower part of the atrial septum. And it receives the electrical impulses from the SA node. And now in a situation whereby the SA node also fails and there's a problem, what happens is that this particular AV node also generates some amount of electricity, which is also very small, all right? And it is about 40 to 60, which is very small. So whenever someone is getting a condition called heart failure, okay, mostly you'll be seeing this particular symptom. It means that we need to boost the heart rate. And then sometimes we say that let's give digoxin to boost the heart rate. And then remember, when we are giving the digoxin, okay, and the heart rate, take note, this is an NCLEX area. When we are giving the digoxin and the heart rate move from 60 and above, it means that you have achieved the desired effect. It means you have to report whether the healthcare provider should stop it or not. Take note, it's part of the NCLEX areas. All right. Now, and then after this AV node, you also have this particular the bundle of His. Okay, and the bundle of His also try to take this particular electrical impulses, and it is spread through. All right, it has two branches before it gets to the Purkinje fibers. And now, if the AV nodes fail, the Purkinje fibers will also come in to help the system or the heart to produce electricity, and that one is very, very minute. The amount that they can generate is from 20 to 40, which is also very, very small. It means that we need to do something to boost the heart rate, which is also very, very critical for us to look at it. Now, diagnostic test when it comes to the heart. Now, it is the one that we are going to use to determine whether there is a problem in the heart or not. Now, you know that we spoke about the cardiac muscle, which is the myocardium. There might be a problem. Remember, I mentioned about myocardial infarction and coronary artery disease. Because if there is ischemia to the heart, what happens is that the blood supply to the heart is impaired, and the heart will start having issues. And how do you determine it? We have cardiac markers when it comes to diagnosis too. And then under the cardiac markers, we have the troponin, we have the creatine kinase myocardial muscle, which is CKMB. All right, and then we have the myoglobin. Now, anytime this particular enzymes increases, it means that the heart has been what? Attacked. That is the one that we use to determine myocardial infarction or heart attack. Take note, or acute coronary artery diseases. And then we have electrolyte. Now, you know, electrolytes also have a very serious effect on the heart. The sodium, whether it is low or high, the potassium when it is low or high, the calcium when it is low or high, and even when it comes to the magnesium and the phosphate, they all have very serious effects. One day we'll take our time and digest electrolytes, and then we'll talk more about it. And we have the X-ray of the chest. It will help us to know whether the chest or the heart has been enlarged, cardiomyopathy. Okay, whether it has what? It has been enlarged, or cardiomegaly. Okay, it has been what? Enlarged. And then we also do complete blood count, or CBC, to determine the amount of what? Blood, red blood cells, and stuff. Because when the amount of red blood cells is decreased, it means that the heart needs to pump faster to be able to compensate the amount that the system is what? Losing. Because when the volume of the blood is low, or when the cells are low, what mostly happens is that, okay, the heart rate will start what? Decline. Sorry, the cardiac, the BP or the blood pressure will start declining. And then the heart will try to pump faster so that at least the vital organs will be able to get blood. Okay, so it can lead to heart failure. It is very, very important. And anemia can lead to what? Heart failure due to this. And it is the one that can also lead to cardiomegaly. Because in as much as the heart pumps faster, okay, you are putting pressure on the heart, and it will what? Abnormally enlarge. Take note of that. And then we have echocardiography, and then we have MRI, and then we can also do B-type neutrolytic peptide. Now take note of this. It is the sole diagnostic tool when it comes to heart failure. B-type neutrolytic peptide, which is BNP. Take note. In NCLEX, it is the confirmatory diagnostic tool when it comes to heart failure. Take note of that. Okay, and then we have cardiac catheterization. We are going to talk more about cardiac catheterization because it is one of the NCLEX areas. And then I will urge you to what? To pay more attention to cardiac catheterization. Okay, because it is one of the diagnostic tools, and it can also be used as what? Therapeutic management when it comes to the coronary artery disease or problem of what? Blockage, okay, to the heart. We can talk about it. Now, before, what happened is that when it comes to the cardiac catheterization, here a particular catheter is inserted through the arteries or the vein, okay, into the heart. And then we can use it to diagnose. At the same time, we can also use it to what? To treat the patient. Okay. Now, if we know a particular catheter is going to be used, it depends on the area that we use. It can be femoral, it can also be the brachial, depending. Remember, we use the larger artery. Well, we use the larger vessels. We use the what? The larger vessel for this particular one. Okay, so that okay, we can have access to what? To the heart completely. It is very, very important. Now, before we do this catheterization, you know that it is an invasive procedure. Because of that, we need to what? Ask for informed consent. So informed consent is needed. The patient has to consent to it before the procedure is done. And then we need to assess the client for any allergies of what? Seafood. Take note, seafood. Somebody will ask, shellfish. All right? Seafood, we need to rule out if the patient is allergic to seafood. It means he is going to react to the what? To the agent that we are going to give, because we are going to give a dye. And that particular dye contains the property of the seafood. So because of that, if the person or the patient is allergic to that particular food substances, what happens is that he or she needs to be given a medication called antihistamine. Or he can be given a pre-medication like corticosteroid or steroid so that the effect will be minimal. Take note of that. Okay. So that is just for the cardiac catheterization. And then you need to make sure that before the procedure, remember, the patient is going to be sedated. A mild sedation is going to occur to minimize the effect. Because of that, you have to put the patient on NEPA or some, okay, when it comes to the solid food, about, let me say, 6 to 8 hours, you need to stop it. And when we come to the liquid diet, okay, you can stop the patient for about, let me say, 4 to 6 hours. All right, so that at least the patient does not aspirate. Remember, in NCLEX, anytime a patient is sedated, that patient is not given anything by mouth. Why? Because remember, sedation, when it comes to those medication, they paralyze the what? The respiratory muscle. They depress the respiratory muscles. Because of that, the what? The desire to cough is not there. So if the patient aspirates, will not be able to determine that. Take note of that. It is the reason why we are not supposed to give anything when the patient is sedated. We have to rule out, make sure the patient is conscious enough, and then we should also notify if there is what do you call it, peristaltic movement or bowel sound before we'll be able to take. Please take note of this in NCLEX. They are very, very crucial areas that questions normally come on. And then remember, the local anesthesia can also be given. And take note, you have to also check the vital signs and the weight and the height of the patient, because we are going to use a dye. And that particular dye, we need to know the weight to be able to know the amount that is supposed to be given to the patient. Because of this, we have to also check, okay, the weight and the height. Very, very important. And then you tell the patient that the patient, during installation of the dye through their IV, what happens is that there can be a flash warming, okay, part of the body, okay, or a flash body, or a flashing of the face, and or a flattering what? Feeling, and then warm feeling. It is normal. Tell the patient this occurrence is normal in NCLEX. Take note. This is also one of the NCLEX areas that you normally ask questions on. Okay, there might be flash face, or the patient might feel warm and sweat, and then also or flattering what? Sensation. When a patient feels this, if the patient complains, tell him or her that this is a normal occurrence due to the medication. Sometimes the patient can also cough, and there might be what? Palpitation also associated with what? With the installation of the dye. Let the patient know about that. And then you can also shape the size of insertion, because we are going to insert a catheter, okay, into the femoral region or the brachia or any other part. What happens is that we need to shape the area with what? Antiseptic what? Agent, so that microorganisms will be reduced. And then we need to what? Insert IV line, because remember, we are also going to give the patient a lot of fluid after the procedure because of the effect on the kidney. In NCLEX, we'll talk more about this. Now, take note. Before this cardiac catheterization, remember that with cardiac catheterization, remember that the dye has a very serious effect on the kidney. And then we don't want to what? Do anything to further increase the damage, okay, within the kidney. Because of that, we have some medication that we need to stop. Take note of that. We need to stop some certain medications. And what are they? One of them that NCLEX love asking questions on is metformin. Metformin needs to be what? To be stopped about 24 hours. Take note. Metformin needs to be stopped for about 24 hours before the procedure, because of the effect metformin has on the kidney. Remember, the dye also have a very serious effect on the kidney. Because of it, stop it. And then after 48 hours, if the kidney function has restored, then we can give what? We can let the patient start the metformin. These are the NCLEX areas. Please take notice of that. Now, let us look at post-procedure. Right after the cardiac catheterization, what are some of the management that we need to do? You remember, it is the heart. We need to monitor the vital signs. It is very important to monitor the vital signs, okay? And then we assess the BP, the pulse rate, and the temperature, and those respiration too is also part of it. And then we assess for any possible signs of chest pain. Now take note, in NCLEX, anytime a patient complains of chest pain, it is a priority. Take note of this. It is one of the prioritization questions. If you are a fan of solving UL prioritization, you'll be coming across this when it comes to cardiovascular. Take note of this, okay? So we are saying that when a patient, take note, has a chest pain after the procedure, you need to report. There might be a sign of what? Maybe pulmonary embolism, maybe coronary artery disease, or any of this sort. Take note, you need to report to the healthcare provider. And then you monitor the peripheral pulses, because you know the bigger artery a vessel has been used. And remember, if you use the artery, bigger artery, it is the one that supplies the extremity with blood circulation. So if we use it, it means that there might be what? Blockage of blood supply to the distal area of the extremity. Because of this, we need to check the pulse area, the pulse at the distal part of where the insertion occurs. And then we also check the temperature there. If it is warm, it means there's adequate circulation. And then we check for any sign of numbness. Numbness. It means that blood supply to the area is impaired. And if the distal area there is severe pain, it also indicates to you that the blood supply there is also impaired. And the temperature there is also very, very important. So tingling sensation and then numbness becomes a very critical issue that we should look at. The temperature, the pulse. You have to assess all this. These are NCLEX areas. You are likely to meet questions on these things that we are speaking about. Okay, and then you monitor for any sign of bleeding at the insection site. Remember to check the bleeding. Why? Because we use the bigger vessel and bleeding can be severe. Then what do you do? Intervention, another NCLEX area. Okay, when the insertion site, the catheter site is bleeding, you can apply a manual pressure. Take note, you apply a manual pressure to the side, and then you can also apply pressure with a sterile material to be able to stop the bleeding. That is very, very important. And then you check for any sign of hematoma. If there's hematoma, you have to also report it because there might be a clot, and that particular clot can also move into circulation to cause a blockage. We need to pay attention to that one more too because it's also part of the NCLEX area. You need to report to the healthcare provider. And then you have to keep the extremity extended for some time because, take note, in NCLEX, if you occlude it or if you flares the leg, okay, what happens if you flares the leg or if you flares the hand that has been used? What happens is that you are going to occlude or block the passage. And this one can lead to occlusion. Blood supply will be impaired. So it is very, very crucial. Never flares. You should always extend the legs for some time. It is very, very important to ensure proper circulation and proper movement of of blood or circulation. Take note of that. So never elevate the head of the bed more than 15 degrees. Because remember, we don't want to flares the body, the leg. Okay, remember, when you put on a pillow, you slightly flares the leg, especially when you use the femoral artery. Take note, it is also one of the things that is not recommended in cardiac catheterization because of the risk of occlusion. Take note of that. It is very, very important to pay attention to this. These are the NCLEX areas. So pay attention. And then you encourage fluid intake. Ladies and gentlemen, the dye has a very serious effect. And remember, the dye can damage the kidney. Because of that, we need to flush the system with fluid. So give a lot of fluid to the patient so that at least the patient, the dye can be flushed away. And then you need to monitor the urine output, the intake and output. Because if the kidney has a problem, it means the urine output will be decreased in adults. Remember, urine output less than 30 ml becomes an emergency. It means that there is a problem with the kidney. Remember, you have to report to the healthcare provider. Okay, the range starts from 30 to 50. Some books will say 60. All right. So from that range, you need to pay more attention to that because they are likely to cause a very serious effect. Please take note. So we'll end here. And remember, don't forget to subscribe. Okay. And then if you want us to talk about content, please don't forget to reach out to us. It is very, very important. We have our email address. Okay. You can contact us from the screen so that we'll address to your content because content is key in whatever we do. All right. So we have a firm that coaches NCLEX, and then we can guide you to pass the NCLEX successfully. American Dream NCLEX Prep is the name. Remember, my name is Abdul Malik, and you can call me Experience One. Thank you once again. Bye-bye.